entitled Realising the Right to ECD, the Right on Paper, the Reality on the Ground, and How to Bridge the Gap. I feel like this event comes at quite a critical moment. As many of you will know, the primary responsibility for early childhood development shifted to the Department of Basic Education in April 2022. And I think that creates a really important opportunity, as our lovely Rebecca from the ECD Directorate in DBE will tell us more. DBE are busy with lots of really important projects, especially around law reform relating to early childhood development and new strategies and policies, and it's a really important opportunity, I think, to be thinking about a right to early childhood development and how that fits into this whole picture. And, you know, for the last few years, the South African government has been more vocal about recognising the importance of early childhood development, but still, of course, there's a gap between that recognition and the reality on the ground, and also in things like funding. So while we are seeing increases to the early childhood development budget, it's still far from what's needed to actually realise the right to early childhood development for every child. So I think this is a super important discussion, and we have some brilliant people here to help us unpack it. So starting from the end here, we've got Sue Philpott, who is an expert in inclusivity, especially of children with disabilities. So she's going to be bringing that perspective to our discussion. We've got Rebecca Hickman, who is from Smart Start but has been seconded to the ECD Directorate within the DBE and is doing a lot of really important work there. So very importantly and usefully, we'll be getting government's perspective on many of these questions. And we have Yusra, who is from CECD, and she's their lead on all their policy and advocacy work. So I think she'll be able to offer a perspective from the ground and practitioners' perspectives here. So without further ado, I'm going to jump into some questions for our panel. So I guess to ground us and to give us some context, Yusra, I was hoping you could speak to the importance of ECD. What do you understand by ECD? What does it mean to you? Why do you think it's so important?
Thank you. Good afternoon, everyone. So when looking at early childhood development, for me and many others, it's more than just the early education part of it, which has been the focus lately, and it's about all the input that's required for a child to optimally thrive and also to reach all the developmental milestones. And that comes from conception all the way until they enter formal schooling. So it's maternal and child health, it's the early education, it's the healthcare services, the social services, the protection services. So it really is the holistic input required for a child to develop and grow and enter formal schooling. And the reason why, for me, early childhood development is so important is because not only does the impact of quality ECD provision have on the child themselves with their own rights as a child already, but it also has benefits to their family and the community, and then also society as a whole. So in a society like South Africa, which is one of the most unequal societies in the world, and us knowing that early childhood development is a crucial mechanism to break the cycles of poverty and reduce inequality, we can't afford to ignore early childhood provision and ensuring increased access and expansion and quality of early childhood provision, particularly for children in poor communities and vulnerable communities. Because a child in a poor community that gets quality ECD, including all those aspects, they're able to enter schooling, they're more likely to complete high school and not drop out of high school, to then gain employment as an adult, less likely to commit crime, there'll be less remedial action. So early childhood development is a very important tool to reduce inequality. And more than it being, and then that affects everything, that affects society, that's businesses and corporations later on when they want capable workforce. And then another thing, beyond just the child's rights or parents' rights and society's right and social justice, it is also a woman's issue. According to the census of 2021, over 198,000 ECD workers across South Africa, and majority of them are women. And these are women who are resourceful and resilient and work many hours and fulfill most of the requirements for what children need in terms of development. So they're providing food, protection, they're social workers, they become the police, they provide a safe space, and yet they are receiving minimum wage, they are undervalued, they are overworked, so it really does become a women's issue. Another aspect of it being a women's issue is not only the ECD workforce, but because of cultural standards and as it just is that women are disproportionately responsible for childcare. So if children can't go to early learning programs and can't be cared for and looked after, women who want to enter the workforce and have an ability to make a sustainable income can't do that. So it really cross-cuts around many issues, and as South Africans, we can't afford to ignore this crucial time in the child's life.
Yeah, thanks, Yusra, and I think it's so important to bring in that perspective, that kind of feminist perspective, that this also really has a lot of implications for women who are primarily responsible still for taking care of young children in South Africa. I wondered, Rebecca, maybe you could speak to the Department of Basic Education's perspective on this. Does what Yusra said resonate with you? Is that how you understand the importance of ECD? Over to you.
So I think, I think government in general has been on an interesting journey that many countries have been on, where ECD began as being seen as a private function, a private responsibility. Then it was seen as a social service and maybe a childcare kind of service. And then recently, that lens has shifted, and it's been seen as fundamentally being about a child's fullest development, including access to preschool learning. So from that point of view, it feels well positioned in DBE at the moment. But there are risks to it being in DBE as well, because the DBE lens is very strongly focused on early learning and stimulation. And as Yusra says, that creates the risk that the other essential dimensions of ECD are crowded out, like maternal and child health, like the right to nutrition. And I don't think, in a sense, that's necessarily, that those elements don't sit within DBE's mandate. So it's not DBE's responsibility to solve for those, but it does raise the question of how is government in general creating the intergovernmental coordination that is going to ensure that all of the departments that hold responsibilities in these areas take on their role and coordinate with each other. And I think what's been very encouraging over the last, actually literally over the last 3 to 4 months in particular, is that the President has effectively stepped in. The President has said, I'm not seeing it happening. I'm not seeing what I need to see, which is intergovernmental coordination and the mechanisms that were established in the ECD policy in 2015 actually up and running. So we're sitting at the moment with the first interministerial committee about to be convened, with the President actually saying he wants to be the person convening it. Which, so, yeah, I mean, I can't tell you how many times I've got excited about it, and I'm slightly jaded after 2 years because I get so excited and then it doesn't quite happen. But there's a huge push in DBE around this at the moment, and just to say as well, the Minister has, and I say this with real sincerity, she has such high levels of commitment to this. She is driving it. She was pulling aside the President last week to talk about it, and she is determined to get that IMC up and running. It is one of the things that young Lee is spending most of her time on at the moment. But I think that's only going to be part of the challenge, because Department of Health, feeling really nervous about all of the recordings around this room that I'm suddenly spotting as I talk about the press. So I'll be Chatham House rules here. But please be discreet with how I am quoted. There's a bigger challenge for other departments. So zooming in on the Department of Health, for instance, they see the elements of their role that they have to take on around this, but I'm not sure they fully embrace it as being a co-leadership role. And that's a problem. And coming back from the conference in Tanzania this last week, where Tess was as well, and a few of us were really lucky to be there, and to hear about what other African governments are doing around interdepartmental coordination, it was really inspiring, and it was way ahead of South Africa. And I found it really interesting to listen to how much emphasis they put on that, and the importance that you're not going to create intersectoral solutions unless you are coordinating well at government level. So, yeah, and I think then the other thing I would say on that, and the other way of getting this really embedded across government as a cross-government priority, is not only about those other dimensions of early childhood development, but it is exactly what Yusra was just talking about, which is around inclusive economic growth and women's economic empowerment, because it's actually around those issues that the president is highly motivated, for instance, and the team in the presidency that we are working with the most at the moment is the Presidential Employment Initiative. For the very reasons that Yusra gave, they see this as a massive opportunity to create jobs in our lowest resource communities, and to create jobs for excluded economic groups. So yeah, sorry, so I've gone on a bit. So I'll pause there. And
that's great. Yeah, thanks so much, Rebecca. And I share the enthusiasm of the room that the President has taken on the mantle of the need for coordination. It is so important. I mean, many of us have spent the whole day discussing what is this right to ECD? Where might you find it in South Africa's constitution, if at all? And I think one thing we've reached consensus around is that it is a very multifaceted right, so that it includes these components of not just early learning, but healthcare and social services and parent and family support and nutrition. And so necessarily other departments apart from the Department of Basic Education are going to have to be involved. And I think when we were discussing, in our advocacy and possibly even litigation around ECD, if we were to focus in on the right to basic education as the home for the whole of ECD, what would some of the risks of that be? And I think, Rebecca, that relates nicely to your point that although there's a lot of opportunities with the shift in responsibility for ECD to the DBE, it's also a risk there that we mustn't just start to think of it as just early learning in just ECD centres. And again, coordination is so important there, I think, to help avoid that risk. Sue, I wanted to come to you now to talk a little bit about the importance of coordination and recognising a holistic right to ECD, especially for young children with disabilities. Maybe you can say something about that.
Thank you very much. I think it's most helpful to deconstruct ECD according to the nurturing care framework. So I'm just going to speak to each of those elements in respect of children with disabilities. Because, for example, the component of health, if we think about health, so it's preventive, curative, rehabilitative, and palliative care. And particularly the element of habilitation and rehabilitation is really, really important for young children with developmental delays or disabilities. So if children are to become independent to the maximum level possible, they need to have those services at an early level, at an early stage. Also, in terms of rehabilitation, includes provision of assistive devices that children may need, for example, standing frames, in order to participate in learning or to improve their posture. They may need mobility devices, and that's all part of health services that young children require in order to develop to the maximum potential. If we look at safety and security, there's a very strong link between disability and poverty. So again, we need to make sure that poverty reduction strategies are supporting children with disabilities, because often poverty predisposes children to disabilities because of poor services such as antenatal care or hazards, overcrowded houses. But that also children with disabilities, it's expensive to have a disability. Your frequent visits to the clinic, purchasing services, maybe having to go to rehabilitation, whatever it is, there are additional costs associated with disability. And regard to safety, the World Report on Disability estimates that children with disabilities are 4 times as likely to experience violence or abuse. And we know what incredibly high figures we have in South Africa regarding violence against children. So it's staggering to think that there are some children that are really a particular risk, may not be able to report what's happening to them or move away from the situation, are dependent for intimate functions on a caregiver. So that's a really important aspect of early childhood development for young children with disabilities. And then when it comes to responsive care, so here parents need a lot of support. Sometimes a parent has a child who is deaf, for example. The child doesn't respond to the parents talking, and that parent ends up giving up and not know what to do, or maybe how to communicate with a child who's got a severe intellectual impairment. And so that parent needs a lot of support to understand what is the child's disability, how can the parent interact and continue and work with the child and stimulate them and encourage that relationship and the bonding rather than just giving up and my child doesn't respond. I think what is also very important in terms of a parent's role is the general ethos in society and beliefs and misbeliefs about disability that's often still seen as a curse or a punishment. And there's a lot of those kind of stereotypes and misinformation that's going on. We have to keep countering, because it's undermining a parent's ability to step forward and look for help at an early stage, rather than just thinking, oh well, the father of the child spoke when he was 4, so it's okay, my child is going to start speaking. Even if he's 3 and he's not speaking, it's okay, it's going to come right. And give every excuse and delay instead of looking for help early. And that is the social milieu that actually encourages and provides a safe space for a parent to voice their doubts or questions. Then in terms of early learning and stimulation, so research has shown that children with disabilities do better in inclusive environments. It's more stimulating for them, and we want to be seeing more of that. That children are in environments that really stimulate them, and they're not just left in a corner just to look at the mobile or whatever it is, but they actually engage with children of different abilities and are really stimulated in thinking. But what I want to say as well is that we often think about inclusion of children with disabilities, but inclusion is about everybody. And everybody learns from diversity and difference and learns from one another. It's not just children with disabilities benefiting, everyone is benefiting. So I really sort of think that ECD in particular has an incredible opportunity to cater for diversity, provide an environment within which children learn from each other and feel accepted and welcome for who they are.
Yeah, thanks so much, Sue. I mean, one of the many things you said that resonated with me was that, the reality is some of the equipment that young children with disabilities might need to be properly included in early learning programs can be quite expensive. And I think, one message that clearly comes from practitioners to the sector is that this subsidy of 17 rand per child per day is wildly inadequate. And I think perhaps even more so in the case of young children with disabilities, that you're just not able to buy that equipment that they would potentially need to be fully included in an early learning program. I was hoping, Yusra, that you might be able to speak a little bit more to what the ECD sector looks like on the ground and what some of the biggest challenges are that practitioners face, including but not limited to the subsidy issue.
Sure. So I mean, as you've all said, is that the ECD sector for decades now has for so long depended on the private sector. It's a private sector performing this critical service with very little funding from government. And according to the census, that 69% of the funds come from parents and otherwise philanthropic organizations or companies. And so what then happens is often the poorest suffer the most because their parents can't afford to pay school fees. And according to the census as well, the average fees across South Africa is 509 Rand. So what can be done with that little amount of money? Yet the over 198,000 staff members at early learning programs use everything that they can in order to provide for children, largely unfunded, and that 17 Rand per child per day, just to add, is something that stayed that amount for 6 years now, or 7 years. It's been 6 years, and that number has not increased. And of that number, that 17 Rand, 60% goes towards nutrition. So 60% is 6 Rand 80 a day. 60% towards wages, that's 6 Rand 80 a day. 40%, 3 Rand 40 a day, goes towards resources and equipment and infrastructure. So that amount really cannot achieve what needs to be achieved. I mean, the World Bank said at a minimum that amount must be increased and expanded to at least 31 Rand per qualifying child per day. And the issue with the subsidy is it is also linked to poor children, but only if the centre is registered. And we already know the barriers to entry for an early childhood development centre to register. And I think sometimes we hear about the barriers and we don't experience it ourselves because we aren't principals who have to go through it. And if I can just give one example on the ground of how bad it really is. So for an early childhood development centre in a poor community to be registered as an ECD centre, they have to reach various municipal clearances and then also child protection. They must have an early learning program, qualified staff and all of that. But the main barriers really do come from a municipal clearance perspective. And so what happens is, before you know it, you have more than 6 children in a community and you need to get consent use from your municipality saying that your ECD centre is currently on land that is mainly residential and now you need permission to operate as an ECD centre. So out of your own, you go and apply to get consent use. As soon as you apply, many municipalities impose an administrative penalty, which says you have now been operating illegally, we're going to assess your contravention and the length of it and charge you a penalty. So in real terms, I have a client, a walk-in case, who has 80 children, 11 staff members, and she had an administrative penalty of 3,500 Rand. She managed to pay that off. After she paid that administrative penalty, she had to start the actual application process to get consent use. And the municipality said to her, because you have so many children, please can you give us a traffic impact report by an engineer, which cost her 15,000 Rand. It took her nearly 2 years to raise enough funds to pay that off. And that's to say that because you have more than the residential amount, you are putting more, there's more impact on the services provided to your property because you're now a business. On top of that, ECD centres have to now also submit noise impact assessments, even if the neighbours have never complained about the noise. I've had an ECD centre, it cost her 12,500. She can't pay that. She's not getting land use. So when you finally get land use, because you submit the documents required by municipalities to assess your approval, let's say this took her 8 years. She then approached us 8 years later with her consent use in place, but now she's read the consent use, understood it, and there are some conditions to her land use which are just making it impossible. The main one are these development charges or bulk contribution costs, which is the municipality saying, we've now looked at your traffic impact statement and whatever else, and basically you're adding pressure to the engineering services. So that's roads, sewage, and because of that, it is only fair that you then pay a contribution to your added pressure to the municipal services. I mean, take a guess at what the development charge was.
I dread to think. Tell me.
195,000 Rand.
Totally.
And that is not
Common.
the highest we've seen.
No, no, that's once off.
A once-off payment.
Yeah.
She was unable to pay it over time, which is why she came to us. She couldn't pay it over time.
Pay it off.
There was no way for that to be reduced. It was close to 195,000 Rand. The most recent one I've seen is 323,000 Rand.
Wow.
So these charges are ludicrous, they are prohibitive. It is government, local government, not recognizing the importance of early childhood development services and the role that they play. These aren't thriving, profit-making businesses. These contribute to the community, and even more so, I mean, the most ludicrous part of it all is that in poor communities, the chances are very high the children are walking to the centre. Staff are taking public transport to the centre. They're not adding to traffic. They're not adding to roads. They're not adding to flushing toilets because they're flushing the toilet next door. They're in the same catchment area. Yes, yet ECD centres have to pay these ludicrous amounts. The most recent thing we're seeing now is because development charges and bulk contributions exclude electricity, there's now a requirement for ECD centres that are seen as businesses to apply for a commercial tariff to electricity. And that includes a bulk electricity charge of 35,000 Rand or more or less. So there really are the conditions to even having consent use, which for the life of me, I don't understand how it has anything to do with the safety and health of a child, but to even start the registration process, that very first step, you have all those financial barriers. So that can rack up to close to 500,000 Rand in total. And ultimately, you just want the 17 Rand per child per day. And essentially, the way it works, you speak about different departments being part of early childhood development and regulations. So once you get land use, you can't move on to the next step. You can't get your fire clearance or your health clearance. Because after land use, you need your approved building plan to be, you need a building plan to be drawn up by a senior architectural professional, and then it needs to be approved. And architects are expensive. So then there's that barrier. And after you've passed the approved building plan stage and your ECD centre reflects all the changes that are required from that stage, you then get fire and health to come up. So when basically making registration a prerequisite for children in poor communities to benefit from government funding, and if registration is that difficult and nearly impossible to reach, even for the wealthy centres, might I add. The wealthiest of centres say they can't pay it off immediately. They don't have 500,000 Rand waiting in cash. It really is not an enabling environment from a regulatory perspective. So that is just a snapshot of ECD centre registration, which many people are not aware of. And to be fair, neither is local government. They work in their silos. The one department doesn't realise what the other department's doing, and it takes sitting them down all together to make them be shocked at the reality of what a principal needs to have a sustainable facility that can care for and teach young children. That is the reality on the ground. And that just speaks to, I guess, early learning programs. And we know that 1.6 million children are in early learning programs, and they're once registered. If anything, only 40% are registered. So what about the other 1 million children that can never access a subsidy if need be? But even more than that, what about the more than 5 million children that aren't in early learning programs? How are we supporting those parents and families and communities that don't have any version of assistance? I can go on and on.
Yusra, I must say, even though I've been immersed in this work for a few years now, you've managed to shock me also with some of those numbers. I think you've given us a really clear sense of the formidable challenges to getting registered. And as you say, there's also not just the question about registered versus unregistered centres, but the majority of children who are not actually accessing any early learning programme at all. So I wanted to move on to you, and I think you have started to touch on this, but I wondered if you could say something specifically about the challenges on the ground for children with disabilities and access to ECD services for children with disabilities.
So I want to frame it by saying that the challenges of inclusion are really barriers of exclusion. And so it's not about the individual children that happen to have impairments, it's how are we organizing our system that makes it difficult or even impossible for certain children to be accommodated. And I would say that a lot of it is rooted in attitudes. And what is the attitude that we're starting with? And as I mentioned before, some of the prevailing beliefs about disability and its causes. And I think often deep down there's a kind of feeling towards parents that we feel sorry for parents of children with disabilities, and we feel deep down that maybe they belong somewhere else, they don't really belong here, and they're so special, they need to be somewhere else in special centres. And then the justification, we're not ready for it, we haven't got the special skills, we haven't got the right facilities, and we come with multiple reasons as to why not. And as we mentioned earlier, what parent is prepared when they have a child with a disability? And yet we cope, that's a child in our family, and we find a way of coping. And so can we not start with that commitment that we welcome every child that's in this community, and we'll find a way of accommodating them, rather than giving every multiple reasons as to why it can't happen. But bearing that in mind, I do want to focus on some of the specific challenges, and I think to highlight the issue of public health services, particularly around early identification and intervention, that really is problematic. We have such stressed and overburdened public health services, primary healthcare services, and that really is where it begins, when there's not a thorough investigation of developmental milestones, and even time just to listen to a mother that's saying, I don't know why my child's not responding, he's not sitting, he's floppy, he's this, he's that, to just validate a parent's experience, and then encourage them to keep observing, rather than just fob them off because there's another 10 people in the queue. I think also the lack of collaboration between, and I think this issue of coordination and collaboration has come up, that it often is just seen this as an issue of the parent. You must sort it out, you must take your child to the clinic, rather than, for example, the early learning program saying we're also concerned about this child, or what perhaps is a physiotherapist or audiologist advising to encourage the child to communicate, and what can we be doing in our centre to reinforce that learning. It just becomes the parent's problem, and that I think is really problematic. Then I think there is a need for training and support to implement inclusive approaches, and I've heard it from within the ECD sector, even when people have training, but there isn't follow-up and support. So we need to see them hand in hand, training and support. And even the training models, we've known over and over again, cascade models are not very effective. We need to be looking at other models, so for example, mentoring or modeling, and actually doing it in the long term, so we're actually institutionalizing practices, and we are providing ongoing support as part of that, a different way of doing it. And also a systems approach, so it's not just certain practitioners are sent for training, but it becomes everybody's way of functioning. Then I mentioned in our earlier session about inaccessible infrastructure, and I think what comes out really importantly is that the need for localization of services, because infrastructure and access is a big issue, especially for children with mobility impairments, but I think it applies to all young children. It's very difficult for young children, for example, to use public transport, things like that. And so we have to see how can we make sure our services really local and available and easy to get to, especially in terms of children that might use assistive devices. And also referred to infrastructure is not necessarily just about ramps and steps, it's also about spaces. Do we have sufficient spaces in our facilities and playgrounds that all children can access and use? And then finally, I think we have to acknowledge the allocation of funding, that we need additional funding to reduce the child practitioner ratio. We need that. And you know, I think we've been looking at the fact that the the allocation per child is so minimal, and how are we going to improve the conditions and reduce the ratios, as well as provide the other resources that children need in terms of upgrading facilities or playgrounds. So I think we can't talk about improvements without looking at what resources that are available could be redirected to improve the inclusivity of services.
Yeah, I mean, we've heard about many of the challenges, including the burdens placed on ECD practitioners by the regulatory framework. And I don't want to turn this into purely an issue about the subsidy and about budget. But yeah, I think that last point you made, Sue, is really important. And as you say, Yusra, that 17 Rand has been frozen at that same rate for 6 years in a row. And Daniel McLaren, who's in the audience, helped us to do some analysis showing that that means when you take account of the rising cost of food in particular and the rising cost of living in general, its value has gone down by about a quarter. So yeah, it really was always inadequate and is now even more so. Rebecca, I'm sure you are aware of many of the challenges already that Yusra and Sue have been outlining. But I wondered, you know, DBE has this goal of achieving universal access by 2030, and I'm wondering what you see as some of the biggest challenges towards achieving that goal.
Yeah, when I saw this question, I wrote a very long list. So to come in sort of from some of what I discussed in the first question is that DB certainly would see intergovernmental coordination as one of the key challenges, and that being cross-departmental within national government, but really strengthening coordination between the different spheres of government as well, and supporting local government to really understand its role and responsibilities in terms of ECD and ECD infrastructure in particular. And linked to that question of coordination is the question of capacity, because what we see is actually really poor capacity, both in central government and at provincial level and at local level. And that's not only a question of them having lack of resources, it's also a question of a real shortage of expertise and of people with the right kind of background in ECD. And that is that's a really, really sticky challenge that national government feels very aware of. I'm sort of coming on to the big ones, but just before, there's another one I think has been data. And it's been really encouraging actually to see the strides that government has been trying to make on this, because it can only do smart policy making, it can only do good funding if it has the right data, if it has an accurate picture of the population, of where our young children are, of the different demographic profiles of those communities, and of what the current profile of provision that's like in those communities. And the DB data team, along with Alifa, have been doing really great and exciting work in terms of building that capacity in government to not only have that data, but to use that data to inform policy making. I just couldn't agree with Yusra more on everything she's just said about the red tape and over-regulation. And we've been on a real journey with DB on this one, because to begin with, the DB's view on it was that we needed to raise the standards for registration. Can you believe it? And so it's been a real journey over the last 2 years of saying, actually, unless we create an inclusive regulatory system, unless we create a realistic on-ramps into the regulatory system, we are going to deny hundreds of thousands of children quality access. because that regulatory system at the moment is failing children. And we've made huge progress. Out of all these areas, I would say that's where we've seen the biggest shifts in government, and that's perhaps borne out in two ways. The red tape reduction work, which after the government longlisted 100 potential economic sectors to look at red tape reduction for, it chose 5, and early childhood development was one of them. And we've met as a weekly technical working group for a year now, nearly a year, and the focus is very much on all the areas that Yusra has just outlined. And Yusra and others here actually attended a workshop in Pretoria at the end of January, where we were actually just really trying to think through what can we put out into local government to support them to see different ways, inclusive ways of discharging their regulatory functions. The second exciting thing is the mass registration drive, and that is going to be piloted. Maybe I shouldn't give a timeline, Kyan, after what you just said. Okay, I won't give a timeline, but soon, very soon, in Gauteng. And there is, there is where 1/3 of unregistered early learning programs are. And it is going to, it is radical. It is a radical change in the registration system, and it is going to ensure that thousands more programs can enter that system.
It's more radical than the other side.
A lot more radical than that. And look, that by itself is not going to unlock it's not going to solve the subsidy problem, because the subsidy problem has its own set of problems around it, and that includes the additional requirements that are layered onto ELPs at the point at which they want to enter into a funding agreement with government. And what we're seeing is that, I mean, I couldn't agree with you more on the fact that the subsidy is just set at a shocking rate, and it is not reaching enough children. But we're still seeing it being underspent. And we're seeing the maintenance grant being underspent. And so this links to like one of the other big challenges out there, which is actually, what are our at-scale delivery systems? Because the problem is that one of the things I've been really curious to observe in conversations with Treasury is that Treasury doesn't like to part with money until it sees the route from the department down literally to the child. It wants to see how this funding mechanism is going to work all the way down. And Treasury isn't really seeing it at the moment. It's not seeing what at-scale delivery systems look like, including the ability of those systems to sort of act as payment solutions for the subsidy to programs, so that they can be the contracting party with government in order that thousands more programs can actually receive the subsidy. And it's those sorts of solutions that we then see Treasury bringing extra money to the table for. And as we are seeing with the results-based financing pilot, which should also be kicking off this year. Just a couple of the other key challenges. I would say human resource development mechanisms, and I know Monica, for instance, has been doing a lot of the work in that area. Such a thorny area, and needs a lot more government attention. And then it's really easy to focus on all the areas that, essentially here we're talking, all of those areas that I've outlined are really talking to the supply side. But actually one of the biggest unlocks in the system is your demand side. It is sharing information with parents, it's empowering parents to be aware of the huge importance and role of early childhood development. And in Tanzania this past week, we were, with other African countries, we were doing systems mapping for ECD. And one thing we kept coming back to was the fact that one of the biggest unlocks in the system is when parents and caregivers have the right information, and what that actually shifts at grassroots level, because it not only creates demand for services, if they have the right information, it creates demand for quality services as well. And then those parents and programmes that emerge can start to self-organise and put pressure on local government. And I would, and on that as well, actually, and just circling back to the over-regulation, I would say that one of the other biggest challenges is the mindset of government officials around ECD programmes. The fact that they see them as some sort of private business or service that needs to be regulated, rather than as first and foremost a public good. And when we've worked with government officials and got them to shift that mindset to seeing ECD first and foremost as a public good, so much shifts in how they then see the policy solutions. My final point is that one thing we've also been trying to do in government is to say, let's not always look at the challenges, the gaps, the deficits, but let's actually talk about the resources, the assets, the strengths in our communities. Because the most sustainable solutions and the most effective solutions are going to be the ones that actually leverage the huge assets and resources that already exist in our communities. And I think that in a sense that's been one of the biggest challenges for government, is that sort of top-down solution building is what it does. And trying to actually understand how communities might see the solution to the challenge of ECD is very hard, and also to be respectful, deeply respectful of the fact that actually communities have been doing early childhood development for centuries. And they carry a lot of expertise, deep wisdom around it, and we actually have to create the mechanisms to learn from that and to include it in a meaningful way in policy solutions.
Yeah, thanks for all that information, Rebecca. I'm going to be a bit cheeky now and see if you don't mind answering a curveball question that wasn't on the list. So, I think sometimes, although we do acknowledge the holistic nature of ECD and the fact that it includes many different components, and we acknowledge that early learning programs are more than just ECD centres, I do think we sometimes leave non-centre-based early learning programs out of the picture too much. And I'm partly looking at Monica here because of conversations we've had about that. So, arguably early learning programs include playgroups and toy libraries and even parent and family support programs as well. And I'm wondering if you could say something about the extent to which DBE kind of acknowledges their mandate for those other types of non-centre-based program, and how you think the sort of challenges are maybe different in that arena.
Yeah, great question. So I think one of the big wins, I don't know how many of you have had the chance to look at the 2030 strategy for ECD programs that was published last week, but one of the big wins in that was the proper recognition of all those modalities. And just to begin with the different sort of early learning program modalities, so the strategy sort of articulates the three main attendance-based ones as being ECD centres, childminders and playgroups. And we're trying in a sense to move away from what feels like a bit of a false dichotomy between centre-based and non-centre-based, because in terms of the law, somebody running an ECD programme from their house with 8 children, that is a partial care facility and it's a centre. But the moment that it's if it's 6 children, it's non-centre-based and it's a day mother, and it doesn't make sense to put sort of quite distinct regulatory regimes on the issue. But actually got to see the continuity between all of these. And I think that when we work with the Children's Amendment Bill, that's one of the key things it's seeking to do, is actually to make visible all the modalities. And the draft Children's Amendment will list all of those modalities in it. So that legislation isn't just geared around the sort of what pops up in everybody's head when they think about an ECD centre, which is but it's geared around all the modalities where we find our children in South Africa. And just to say specifically as well that it has been really heartening to see DB properly recognising that in the foreseeable future so many of these programmes are going to be run out of homes, and you cannot exclude them from your regulatory net, because actually in the absence of huge amounts of funding for new infrastructure, that is going to be the only way to unlock access in the short to medium term. On the parent support programmes and home visiting, I think the tricky thing there has been that is a great example of the type of ECD programme that sits across 3 departments, because actually Department of Health obviously have a clear locus in that, as does the Department of Social Development. And when we started trying to develop detail on that in the ECD strategy, we realised that actually that there was a real risk in sort of trying to DPE to lead that, because actually arguably Department of Health and DSD have a greater locus in those types of programmes, and actually what's needed is for them to take a meaningful ownership of their role and responsibility in terms of those programmes. So you'll see there are sections in the strategy that talk specifically about those programmes and how government sees the next steps in terms of developing a plan for them. But the detail is deliberately vague, because the thinking is that with the review of the National Integrated ECD policy, which is currently ongoing, that provides the proper vehicle to actually look at how those 3 departments should work together far more effectively around home visiting and parent support.
Thanks, Rebecca. I'm glad I just went for it and asked the curveball question. Okay, I have one last one for each of you, and it's the same question to each panellist. If you had to pick 1 or 2, if you're lucky, 1 or 2 priorities to bridge the gap between the right to ECD on paper and the reality on the ground, and action to do that, what would those priorities be? Sue, I'm going to start with you, and maybe you can pass the mic back down to me.
Okay, thank you so much. So my 2 picks are, I think we really need to adopt an approach of all means all.
Yes.
And I think to me that is absolute key, that we shift our mindset so we really do take it seriously that every child belongs in our system. And also not just all children, I'm thinking all parents, all ECD practitioners, all officials, and that's not limited to children. Just inclusion and effective ECD systems is everybody's business. And so really that kind of holistic and comprehensive thinking is absolutely critical. And I think in that it involves being prepared to try new things, doing things differently, and being prepared to learn by doing. Also this requires a different approach in terms of local government and what happens in municipalities, and I think that is a key place where we can begin to be linking those all at a very local level. My second pick is that I really want to link inclusion and quality. And if we think about the Sustainable Development Goals, they refer to inclusive quality services. So those should always be together, the 2 sides of the same coin, inclusive quality services. And so we recognize inclusion as a measure of quality and an element of quality. And I just want to want to make 2 other comments. One is you mentioned the importance of data, and I think part of the measurement of quality is looking how do we disaggregate data and constantly look at which children are not part of our services and who is being left out, and that requires disaggregation of data. So I think that's an important, very important element. Even how do we look at children with different functional difficulties and how they're being accommodated. But I just wanted to end with an account of an evaluation we did at the end of an 18-month program of supporting ECD practitioners in KZN. And at the end of the program, we went and asked the practitioners what has been the most important element of the training that's enabled you to learn more and adopt inclusive approaches. And one particular ECD practitioner we interviewed, she just, in reply to that question, she just said, Elifle. And Elifle was the name of a little girl, 4-year-old girl with spastic diplegia. She couldn't walk. And for the practitioner, it was just naming this child, by including this child in our program, she's enabled us to learn. So we can give a lot of, training and support, but until we actually do it, and we do it in a way that enables that child to teach us what inclusion means, I think we won't be taken much with it.
So I mean, I've got 3. Am I allowed 3? Okay. So the first one is the inclusive regulatory regime. I mean, for me that will be an absolute game changer, because that is what will ultimately unlock funding for our most under-resourced programs. Then the 2 others that I've picked are firstly this social compact for ECD, which the new strategy has launched. And that's not supposed to be some sort of hey, wow, fuzzy sort of idea. The idea underpinning that is that actually we're only going to create quality access at population level if we have a whole of society effort. It's not going to be the government by itself that does it. It's really, really not. And if we wait for that, we'll be waiting forever. It requires NGOs working in partnership with each other and with government. It requires business coming to the table. It requires donors aligning their funding far, far more strategically than they currently do. So that social compact for ECD, I think if done well, if done properly, like in a meaningful way, where actually the different stakeholders in that social compact really codifying what it means, then I think it could be tremendously powerful. And then my third just really circles back to what I was saying earlier around the empowerment of parents with knowledge. I think if we can prioritise that, how we share knowledge and information to parents and caregivers in every single community, we will also see really significant shifts.
Sure, I mean, it's very different to you, limited to 2. But I would say that bridging the gap between the right of ECD on paper and the reality on the ground is for government to know the reality on the ground. And that is why the data capturing was so important, the census, the Thrive by 5, the World Bank report, the sector thanks DVE who commissioned those pieces of research. But even more than that, it is when developing solutions and interventions, understanding the community it's going to affect. And the community is diverse, so you need different solutions for different parts of South Africa. And I can't emphasize that enough, because it's not a one-size-fits-all. You have all the modalities of early learning programs, and they're all in different socioeconomic contexts, and the poor need more support. So it really is about constantly being connected. And I find that we start with this enthusiasm, which is so great and wonderful, and we're very excited about what's happening at a presidential level and national level, but it can't stop, and you can't stop going to communities, speaking to ECD nonprofits who are in the communities, but more importantly, parents and mothers and staff members who know more than the ECD MPOs who are taking it from them. So it's so important to keep that connection, and I really hope you do keep that connection. And then not only, I mean, there are processes, there are legal processes that allows for community participation and public participation. But I can't for the life of me understand why government doesn't conduct proper public participation. So finally, when we inform the sector, we tell them their rights, and they are aware of their rights, and we all act and we are empowered, and we use the public participation mechanisms, and then government doesn't listen. They don't listen. They don't, and they don't give you reasons for not listening. And then in order to make sure that the decision making was justified and reasonable and rational, then you've got to go the legal advocacy route. First prove as administrative action, and that is a long, long process and requires money and funds and resources that we can't afford to waste on challenging government and holding government accountable. So my second thing is for government to do their job. It really is, because it definitely is a private-public sector. It's not only government, but the reality is it hasn't been government. We've all come to the party. Parents and the communities, and we've all been there. There's organizations and companies and donors. It's privately supported. Government has to do more. And my concern is this incremental approach, like everything is going to be okay. And I don't know if it's an attitude shift, because ECD is in crisis. And you can't postpone providing quality ECD provision for children. If we know that 90% of a child's brain develops by age 5, how can you miss that opportunity? You can't get that back at a later stage. If we have all the data on by 5, 1 in 4 children are stunted. Government is estimated to spend 62 billion rand on stunting in this country. So we have all the data. We know 57% of children don't thrive by 5. So we had all that data, but we couldn't get an expansion or increased ECD subsidy. It's ludicrous. It's absolutely ludicrous, and I don't understand what's happening. And that came before the budget was announced. All that information sat within government, across departments, with the president, with Treasury. But they're failing the children right now. Children have current rights. They're failing also the future of the country. And so my 2 things are actually quite simple. It is stay connected to the ground and for government to do their job.
Wow. Thanks to all the panelists, honestly. That was fantastic. I realised I actually didn't introduce myself at the beginning. So I'm going to channel my inner podcast host and say, I've been Tatiana Kazim at the Equal Education Law Centre. And this has been the Realising the Right to ECD panel, brought to you by the Equal Education Law Centre in collaboration with ENS. And in all seriousness, thanks very much to ENS, and Jana, thank you for lending us your beautiful space. Okay, we are going to open up for questions and answers, and I'm sure there are a lot. But if I could ask you to put your hands down for a minute, because I first want to invite to the stage or the podcast or whatever this is now, Tsepo, who is my colleague on the Real Reform for ECD campaign, and who is going to give us what I like to think of as a suggestion or a solution to realising the right to ECD.
Yay. Hello everyone, also known as a shameless plug I'm about to do. So as you know, we're in the election year, and when we're approaching the election like this, all the political parties release a manifesto. A manifesto is a document the political party puts together with a bunch of promises of what they will do once elected into parliament or in power. So Real Reform has reviewed the manifestos that currently are out there,